Jeanette.
Hi, my name is Cindy Dennis. Today is October 21st. I'm going to be giving my speech in a few minutes on stroke. So we just received our stroke recertification. I'd like to talk to you all today a little bit about stroke. According to the American Heart Association, stroke is the third leading cause of death in the United States. It is surpassed only by heart disease and cancer. And it is the leading cause of major disability in the United States. 750,000 people a year suffer a stroke, and that's about 2,000 people a day. I think those statistics are staggering, but I also think we can do something about it with education. As you all know, most of you know, I've worked here for a long time. I'm not going to say how long. But I worked in critical care for over 18 years. And I've seen a lot of stroke patients, have treated and educated a lot of stroke patients. And I am NIH certified. And what that means is that I have the certification to assess a patient with the NIH stroke scale to determine the amount of brain injury after a stroke. So what we're going to talk about today is how to identify the patients who are at risk for stroke, the types and treatments of stroke, and how to educate patients, how to act fast, and identify patients who may be exhibiting symptoms of stroke. There are two major risk factor categories of stroke. There are controllable risk factors and uncontrollable risk factors. Now, under controllable risk factors, we have the medical risk factors, which would include things such as high blood pressure, which is actually the most important, atrial fib, which will increase your risk of a stroke 5 times, high cholesterol, diabetes, and atherosclerosis. Your controllable lifestyle risk factors would include smoking, which would double your risk of a stroke, alcoholism, obesity, drug abuse, and a sedentary lifestyle. The uncontrollable risk factors would include things such type as age, and even though a stroke can occur at any age, the majority of strokes do occur over patients age 65. Gender also plays a role. Males have less strokes than females. If you've had a previous stroke, you're more prone to have a stroke. Race plays a part. African Americans have more strokes than Caucasians. And heredity also plays a part. So what can you do to help prevent strokes? You can educate your patients about their blood pressure medicines. Make sure that they are compliant with blood pressure medicines, anticoagulants, antiarrhythmics, and carotid endarterectomies can help. Angioplasty and stents all can help reduce the risks. So we have 3 major types of stroke. Ischemic stroke accounts for 87% of all the strokes. And what an ischemic stroke is when a blood clot lodges in your brain and cuts off the circulation to an area of the brain. And it can lodge anywhere, so it can cause different kinds of symptoms. The treatment for ischemic stroke is TPA. TPA is tissue plasminogen activator. It's a very powerful blood thinner. You have a 3-hour window in which you can give this drug. And that's 3 hours from the onset of symptoms. That's why they say think fast, because you have to act very fast in order to give this drug. If you give it past the 3-hour window, it can actually cause bleeding and do more harm to the patient. Second type of stroke is hemorrhagic stroke, which is bleeding into your brain. It's caused by a rupture of a blood vessel in the brain. The only treatment for that is surgery, where they actually can go in and clamp the blood vessel. So, how do you differentiate between the two? The only way is through imaging, CT or an MRI. you have to do that before you can treat the stroke, because if you were to give TPA to a patient who has a hemorrhagic stroke, you're going to cause more bleeding. Now, a ischemic stroke doesn't always show immediately on imaging. However, hemorrhagic stroke does. So you can rule out a hemorrhagic stroke and go ahead and give the TPA. The third type would be a TIA. Now, a TIA is where a clot or a small piece of plaque will lodge in your brain. It's a temporary condition. It lodges just for a short time and then dislodges. There's no treatment and there's no permanent injury. However, a TIA is normally a precursor to an ischemic stroke. What you can do to teach your patients would be teach them symptoms of a stroke, risk factors of a stroke, how to control a stroke, what they can do to take their medicines, be compliant with their medicines, what you need to look for in any patient who may be exhibiting signs of a stroke. You need to think about the acronym FAST. We think about F, which is the face, which would be numbness, tingling in the face, any kind of drooping in the face, drooping of the eye, mouth drooping. If they smile, only one side of the face goes up, or one side of their mouth goes up. A stands for arm, which they're having difficulty moving their arm. Maybe they can't grasp. They may have numbness or tingling of the arm feels heavy. S stands for speech. They have difficulty articulating words. Maybe the tongue feels thick. Maybe they can't speak clearly. Their speech is garbled. Or maybe they can't understand what you're saying. And T stands for time, which means it would be time to call for help. If you're at home and you notice someone having these symptoms, you would call 911. If you're at work, you would call a rapid response. Other symptoms could include severe sudden onset of headache, changes in vision, dizziness, or balance problems. So we've talked about types of stroke, diagnosis, treatment, risk factors, how you can control them, how you can reduce or even remove them, signs and symptoms of stroke, what you can do for your patients, and how to think fast, F-A-S-T. And what I want you to remember is the faster that you act, the faster we can get to the patient, the faster we can help the patient, the faster we can restore blood flow to the patient. And remember that time is money. Thank you. So now if you want to fill out your little evaluation, that would be great.
Do you have more?
No, nothing more.
Huh? Yeah.